Catherine, thank you. The Cincinnati Bengals are going to have to continue their season without star quarterback Joe Burrow. He's been diagnosed, as we all know now, with turf toe, and head coach Zach Taylor says the quarterback is likely going to need surgery. So joining me now to talk more about turf toe and what the surgery and recovery process looks like is board-certified and fellowship-trained orthopedic surgeon Dr. Amelia Wiggins with Ortho Cincy. So thanks so much for coming in. We said we needed to be clear. You're not actually treating Joe Burrow. But just talk about, were you watching Sunday's game? Did you see this happen?
I was, yes, I saw it happen. And I watched him go off the field, and I told my husband and my kids, I was like, oh, I bet he has turf toe. And they were like, why? And I said, well, it's just the way he landed. I said, I bet it's turf toe. They'll put him in a splint, he'll be fine. You know, because usually most of the time with turf toe, you can just put like a hard insert into the shoe to decrease how much you lift off, and you're fine. So I was like, it'll be a couple weeks. That's
not the case.
That's usually what happens with turf toe.
You were saying just a small percentage are usually this grade, because they are graded, I believe, and this
correct.
is stage 3 or level 3.
Exactly. So it's graded 1, 2, 3. Very common in football players. About 30 to 40% actually of football players will have one at some point in their career. Only 2% end in surgery.
Wow. So
not very common. Certainly we're going to see more aggressive treatments with our professional athletes because we need them to get back. But the grades are, grade 1 is just a stretch of that plantar plate. Grade 2, we'll start to see some partial tearing. Grade 3, the entire plantar plate, which actually holds the first toe stable, and that entire plate can rip off the bone. There's two little bones that are incorporated into that plate, and those act as a fulcrum when we lift off. Those bones can fracture, which would obviously require a surgery to fix. You can have a cartilage damage to the joint, which would require us to do a surgery.
How painful is this for somebody who's never experienced it?
Yes, it's very painful, even if it's at a lower grade. You know, a grade 1 will sideline athletes for, you know, a couple weeks. A grade 2 will sideline people for about 4 to 6 weeks and often result in a boot and therapy. And so a grade 3 is much more severe.
The name is so deceiving. You know, everybody was hearing turf toe, and I was seeing all the reactions on social media where everybody kind of is laughing about it. Doesn't sound like it's anything to laugh about at all. As far as, you know, we were talking a little bit during the break, are football players most susceptible to it, or is it really any sport that's on turf?
Any sport that's on turf with the cutting and the pivoting, you know, with the lift off. So football players get this a lot, wide receivers, running backs, quarterbacks, you know, we'll see them a lot.
Positions, as well as, I know we were saying soccer.
Soccer, you'll see a fair amount, volleyball, basketball, even tennis, going back and forth on a hard surface where your toe, you know, you're going to hyperextend and get that lift off.
What is it about turf? Because you were saying it actually is turf, not grass, that you're going to get this on.
Correct. We saw a big bump in this injury in the 70s when we started to go away from grass to turf, because grass has give. You know, so if you go in to plant your foot and lift off, that grass is going to give and let your foot slide a little bit. Turf, the first generation of turf that was laid, that AstroTurf, was so hard. You know, it didn't have any of that give. And so then your foot goes into it, and the plantar plate is what takes the stress. So we saw a lot of injuries. So now, then there was a grade 2 generation of turf, and now we're on the grade 3 generation, which is what the Bengals play on in most sporting events now. It has a much softer cushion that replicates more of the grass surface. So we do see less of it and less severe, but with any cutting, pivoting, jumping sport, you're always going to see this.
So again, I know you're not treating them, but quickly, because we're running out of time. 3 months, is that optimistic to you?
It's maybe a little optimistic, but not unreasonable, you know? So after surgery, the literature shows that high-level athletes, elite-level NHL or NFL athletes can get back in about 18 weeks. So, you know, 4 months, 4.5 months is the average, but there's a 70 to 90% return to your pre-level of play, even at the professional level. So Joe Burrow has done this before. He did it with an ACL that has the same return to play rate. He's done it with his wrist. He's done it with his calf. He knows how to do this, you know. It doesn't have to be career ending, but he's gonna have to take his time and recover. So 3 months, maybe a little tight. I think 4 to 6 months is realistic.
All right, well, thanks for sharing the silver lining out of all this. We sure appreciate you stopping by today.